how to overcome white coat hypertension, or how to prepare yourself for going to see your doctor when you've been getting very, very good BP numbers so he can remove some of the drugs you're currently taking for blood pressure. Welcome. On this video, we're going to really go in depth on how to prepare yourself for this. We're going to discover what your goal should be with your doctor's visit. Number 2, we're going to go over 5 specific activities that you should start to do from right now as you prepare to go for your doctor's review. Number 3, we're going to set your expectations right to manage whatever comes out from your visit to your doctor. Welcome once again. My name is Pharmacist Chibuamam Ilechukwu, founder of Hypertension Africa, where we help you wake up every morning to normal numbers so that you don't have to rely on so many drugs for it or endure all the adverse effects that come from everyday swallowing pills. So basically, what we're going to be doing on this video is twofold. We are assuming that for the past 2 months at least you have been getting very, very good BP readings, like 120/80 or even less. And now you feel like, I've been getting such good numbers, I don't need to be on these 5 medications or 4 or even 3 medications. I want my doctor to go over everything, and I want to explain to him how I'm feeling now. I want him to run whatever test he wants to do so that he can take off my medications. Wouldn't you love that? Now, if you are not yet at this point, if you're just saying, I just want to control white coat hypertension, right? This is going to help you, but this would not be the most ideal thing for you. So to get started, we're going to link a webinar in the comments to really show you exactly the high BP reversal method, how it works and how it can help you to get to this point where you want to go and get your doctors to remove your drugs. All right? So, but let's assume that you are ready. Like for the past 2 months, you're so happy with the kind of numbers that you're getting, even with your medications or even skipping your medications, you're getting very good numbers. Let's get started. So before I go ahead to tell you the 5 activities that you should be doing as you're preparing for your doctor's visit, I'm going to tell you experiences of at least 3 different people who have gone to see their doctor for a review like this and how it went. So the first woman, she went to see her doctor, and the first time the doctor saw a number like 120/80, he was shocked because all this while the woman's BP was very, very uncontrolled, and the doctors, actually her cardiologist, didn't know what to do with her, and they kept increasing and changing different drugs for her. So when he saw 120/80, he didn't believe it. He actually told her, Madam, you can't get off these medicines because I don't believe it. I don't want to put you at risk of saying withdraw your medicines and then it backfires, because this is going to jump up. This is more like a fluke. And so he told her to come back in a month's time so that if she could still get a number as good as that, then he would be ready to take off her medicines. And this totally makes sense because everyone is out for your best results so you don't put yourself at risk. The number 2 person went to see her doctor, but on that day, her number jumped up. So she got numbers like, I think about 150 or 140 something over 90 something. She immediately at her doctor's office snapped the BP monitor and sent to me and said, I've not seen this kind of number in at least 2 months. How come this is happening to me? I quickly said, you know what, finish with them. In fact, the doctor wanted to even increase her dosage, not until she pulled out her trackers. Remember, I told you have to go with your tracker, and show the doctor records of what her readings had been for the past 2 months. And so the doctor, knew that he won't have to increase her drugs, but then said, you have to come back and show me this kind of results in my office before I can take off your drugs. Now, the third person I want to tell you about is a young woman, Julie. She's my friend. That's why I'm mentioning her name. So when she got very good numbers within 2 weeks of using the high BP reversal method. When she went back to see her cardiologist, the woman was shocked because she got something as 98/60 something, like it was woo. And guess what she told the doctors? What the doctor told her, like, you are a smart woman. You're a smart woman because you were just diagnosed. Within 1 month, you started working on your numbers and look at what you're getting. Of course, the doctor had to pull off the drugs. No doctor is going to continue to keep you on 98 on drugs when you're getting BP less than 100/60, right? And these are real life experiences. Why I'm sharing this with you is for you to really understand. Now, let me complete the first woman's story. A month later, she went back to her doctor and her doctor actually pulled off one of her medicines because she was still able to produce that same number in his office. She got about 120/80 again while in his office, and he's like, okay, stop taking this drug. And before you take another drug, make sure you always check your BP in the mornings. Now that is what can happen when you get it right when you're going to see your doctor. So without much ado, let's go over 5 ways or 5 things that you have to start doing as you prepare. Now, ideally, you should start to do these things at least 2 weeks before your doctor's appointment. The reason we say 2 weeks is to give you sufficient time to really rewire your brain, prepare for it mentally, emotionally, and physically. So number 1 thing is work from a place of certainty. You have to know that it's going to be a good experience with you. Like, there is no point in being afraid and saying, oh my God, how is it going to be for me? If you're very, very, ideally, if you've been working your numbers, I mean, your numbers are already good, right? So you need to know that it's also going to be good at your doctor's office. You don't have to live in fear of what's it going to be. I mean, why are you scared? Why are you going for the review? You're going to show your doctor what you've been doing. You should be excited about the opportunity to show another healthcare professional what you've been doing for the past 1, 2, 3 months. So it's an exciting opportunity. So you have to rewire your mind. You don't have to work from a place of fear. You have to work from a place of certainty. You've got to believe it, that it's going to be a good experience. You've got to know it, and you've got to manifest it. Now that takes me to number 2. Number 2 is almost like what we did when we're doing mind detox. What we say, you've got to write down your expectation, visualize it, and affirm it. Okay, so this number 2 is you've got to write down the date of your appointment. If you don't know the actual date you're going to see your doctor, but you know the month, like, you know, I'm going to see my doctor in December, write down December and write, this is my month of joy, or December 22, this is my day of joy. Now, the reason you're going a step further is you are, reconditioning your mind to know that it's going to turn out fine. And it's like you're making a prophecy. So you want a self-fulfilling prophecy. So why don't you use that? This is part of what we teach you in mind detox. So you have to use it at this point as well. Ideally, when you write this down, you should have it, put it on like if you have a bathroom mirror, or if you have a mirror, you're always going to paste it there. And so you always see it. So it's a constant reminder that, hey, it's going to be a good time for you. That takes me to number 3. Use your constant affirmations and visualizations. Now, what this means is, yes, you see the date, oh, this is my day of joy, this is my month of joy, but you've got to take it a step further. During your power morning routine or your visualization, visualize yourself walking into your doctor's office. I mean, not somewhere that is entirely new to you. You know this place, you know your doctor, you know how it is when you go into this room. See yourself walking. So you can, in the mornings when you sit down, you see yourself, you shut your eyes, see yourself walking into your doctor's office. See yourself saying, hello, doctor. How are you today, madam? How are you today, sir? I'm very well, sir. I'm here to, for a review. And then see the doctor checking your BP all over again. Or if it's checked by the nurses outside, see yourself getting a reading and getting 120/80. You've got to see yourself or getting 110/70. Now visualize that. Visualize your doctor saying, wow, you've done so well for yourself. Yes, you have to take up these things so it doesn't drop too low, but you've got to monitor. Visualize that. Confess it. Now, it's really, really important. Remember the CCR technique that we taught you? It means you've got to catch it. If you always say, I'm really scared about my next doctor's appointment, guess what? Then something evil is going to come out of it. So you want to make sure you're not living in fear. You confess it. Yes, I'm having a good time. Oh, it's next month. I'm really excited for the opportunity. It is a great opportunity. Not everybody. People pray and wish for this, but many people don't ever get to this point where they are going for a review like this. So you have to be excited like a kid about it. And you have to visualize it, say it out, and confess it. So that takes me to number 4. You've got to physically train your body for a great experience. Now, this one is really, really huge. Let me explain to you what white coat hypertension is. So in this most basic sense, it just means that when you see a white coat, either your doctor's white ward coat or a nurse, your heart immediately starts to race. You start to feel, it's like a physiological thing. You start to feel anxious, like, oh my God, they're about to check my BP. And then guess what happens? They take your BP reading and it's actually high. So you have to physically train your body for your BP not to jump up when it sees a white coat. So how do you do that? You have to desensitize your system. Now, what this means is, for instance, for most of us, we have a BP monitor at home, so we're always checking in the mornings or in the evenings. So you're in your normal environment, you're living your normal life. It's you checking you, so it's normal to you. You don't have any issues with that. But when someone else is doing it, that's when you have the issues. So you want to desensitize yourself. So from today, go out, walk into a pharmacy and ask them to check for you. You want to get used to seeing a white coat and just know it's just white, right? You want to get used to the whole experience of, hey, madam, are you here? Okay, take some rest and check your BP. That way you're desensitizing your nervous system to the hospital experience and the anxiety that comes from the external measurements. So that's what I want you to start to do. Maybe every week, twice a week. So if you notice that you do it the first time and it jumps up, that means you want to do that more often. But also a ninja tip for this is, when you get into that environment, whether it's a pharmacy or the hospital, you want to sit down and do your deep breathing exercises. Remember how to do that. You take a deep breath. You can count 1 to 10 and then breathe out again. It will slow down your heart rate so that your heart is no longer jumping up. So you do that for at least 5 minutes and then you're ready. And then picture yourself getting good numbers. When it starts to squeeze your arm, don't even, it's normal. Just continue to remind yourself it's normal. My numbers are very good. Like you guys just have to see it with your monitor to see. Even if they're using the manual one, they're still going to get good numbers. So when you start to prepare yourself for it, on that day, it's going to feel like second nature to you. Like, okay, hey, you want to check? Yes, please. You give them your arm. Does this make sense? Absolutely. So let's talk about number 5, which is preparing yourself for the D-Day or on the D-Day. Now that morning, there are a number of things that I would recommend that you do. So number 1, you, of course, when you wake up, do your visualization again, your meditation, your affirmations, you're ready for it. Another thing I want you to do is check your BP that morning before you head out to your doctor's office, because you want to see your BP reading just the morning before you enter the office. So check it. Number 2, write it down on your tracker. When you write it down, number 3, take along your tracker, and if possible, take your BP monitor as well with you, because that's what you've been using to measure. And then take your tracker with you. And then number 4, when you go to see your doctor, do all the deep breathing even before it's recorded for you in the hospital. And then when they take their reading, if it differs very widely from what you got before, bring out all your records and show them, okay? Show the doctor. And if it doesn't even differ, wow, fine, but still show them a track of everything that you've done. Because doctors or medical practitioners, we don't rely on spoken words. We only rely on science, on what the monitor says. Nothing you say is going to beat or it's going to upturn what the reading is in real time. So, but if you have been tracking with date and time, obviously that's like evidence that you've been tracking. And this definitely beats even machine readings, which nobody knows whether it's for you or not, or the person. So go with all those. And then I wish you a very, very good experience seeing your doctor. Now, let me quickly say, what if you do all this and you do everything right, you've started following everything that I shared here, and you go and it doesn't turn out like you do? Let me manage your expectations right. Whatever happens, I need you to know that that is not the end of the road. In fact, it is a call to action. You should be excited that, wow, you even got this far. So for one of the women, she went to see her doctor and she was so excited because her doctor gave her a clean slate, like you can go ahead and have your baby. Because before then, the doctor had warned her never to get pregnant again because her BP was just off the charts, and it was he knew that it would put her life in danger. But she went and then she got the clear. You can go ahead and have your baby. So let's say everything doesn't work out fine. Well, just remember that that experience, that singular experience, does not negate every BP reading you've been getting in the past, which was very good. It doesn't negate even your preparation. It just means you need a little bit more preparation to get your body, to master your body better. And the truth is, if you've done this for the past 2 weeks, and then you're ready for that day and you still don't get it right, well, you now have a longer period to prepare, to visualize, to work on your body, to master your nervous system. So you just go back, prepare again, and go again. All right, so basically this is it. I hope that you enjoyed this video. Don't forget to like it, share it, subscribe, and more importantly, get our resource. Like, if you don't even know what we're talking about, like tracker, this, that, well, we give all these and more, and even more detailed go-to and steps within our programs. We have our do-it-yourself programs, and we also have the coaching programs that allow you to go from confused, I don't know where to start, my BP is haywire, to my BP is so good, I want to go see my doctor so he can review my medications and take off some drugs for me. Everything is beneath this video. Make sure that you get them. Like, subscribe, share. I'll see you around. Thank you for watching. Bye.